Beta blockers. What are beta blockers? Beta blockers or B blockers are a class of medications that block the effects of the hormone adrenaline, epinephrine, and noradrenaline. They work by attaching to beta adrenergic receptors in the body, which are sites on cells in the heart, lungs, and other tissues where adrenaline binds to trigger a fight or flight response. By blocking these receptors, beta blockers help your heart beat more slowly and with less force, which lowers blood pressure and reduces the heart workload. This makes them essential for treating a variety of cardiovascular conditions. This is your heart without a beta blocker. The adrenaline reaches the heart. Your heart rate is fast. With a beta blocker activated, it's gonna block the adrenaline, and your heart is gonna be less. It's gonna be relaxed and beats with less force. Mechanism of action, how they work. Beta blockers competitively block beta adrenergic receptors from being stimulated by catecholamines, adrenaline and noradrenaline. There are two main types of beta receptors they target. Beta B1 receptors located primarily heart and kidneys, beta 1 heart and kidneys. Blocking beta 1 receptors decreases heart rate, negative chronotropy, which is slowing down the rate of heart contractions. It also decreases the force of the heart's contractions, negative inotropy, weakening the force of muscular contractions. In the kidneys, it reduces the release of renin, which is an enzyme that helps control blood pressure by constricting blood vessels, which helps lower blood pressure. Beta B2 receptors located mainly in lungs, blood vessels, and muscles. Beta 1 in heart and kidneys, and beta 2 lungs, blood vessels, and muscles. Blocking beta 2 receptors can cause smooth muscles contractions, which may lead to bronchoconstriction, which is the tightening of the airways in the lungs, which can make breathing difficult. A concern for patients with asthma. That is very, very important to remember. Beta 2, we don't want to block them because it might cause bronchoconstriction, which is a concern for patients with asthma. It can also cause vasoconstrictions, which is a narrowing of blood vessels. Let's see with this the effects of cardioselective beta 1 and non-selective beta 1 and plus beta 2. Not all beta blockers are the same. Their main difference lies in which beta receptors they target. So, cardioselective beta 1 primarily blocks receptors in the heart. This is safer for patients with asthma or COPD as it avoids acting on the lungs. Non selective beta 1 plus beta 2 blocks receptors in both the heart and lungs, must be used with caution in patients with respiratory conditions. Third generation vasodilating beta blockers. Some newer beta blockers have additional effects like blocking alpha receptors or stimulating nitric oxide release, which causes blood vessels to relax and causes vasodilations, which is the widening of blood vessels, which decreases blood pressure. This gives them extra blood pressure lowering power. For an example, carvedilol and lipitatolol block alpha, beta 1, and beta 2 receptors. Nivedolol, Nibidilol, this is very, very popular in the US and for celebrities to take them. I think even Robert Downey Jr. takes this type, which is a cardioselective beta 1 blocker that also promotes nitric oxide release. Common uses and typical dosages. Beta blockers are used to treat many conditions. Click on a case file to see common treatments and dosages. For hypertension, a goal for to treat hypertension, the goal is to lower blood pressure to reduce cardiovascular events and risks. For example, metoprolol cisinate, 25 to 100 milligrams once daily. So that's how we would take a beta blocker to treat hypertension. It's not only like that. You should see my previous video on hypertension to recognize how you would use a beta blocker if there is a compelling indication that the patient has. For an angina pectoris, a goal is to reduce myocardial oxygen demand to prevent chest pain. For example, we take atenolol 50 milligrams once daily. For heart failure with reduced ejection fraction, the goal is to block synthetic overstimulation to improve cardiac function and survival. For example, carvedilol started very low at 3.125 milligrams twice daily and titrated up. Post myocardial infarction is the goal is to reduce risk of a second heart attack and improve survival. For example, we take metoprolol titrates 50 milligrams twice daily. Erythromitis, the goal is to control rapid heart rates, for example, in arterial fibrillations. For example, we're going to take a propanol, 10 to 40 milligrams, 3 to 4 times daily. Migraine, post migraines, or to reduce the frequency and severity of migraine headaches. Propanol, 40 milligrams twice daily. These are the drugs in common use and typical starting dose and the max dosages. For metoprolol tartrate, they're commonly used for hypertension and angina, typical started dose of 50 to 100 milligrams a day in 2 divided dosage. Max dose, this is the maximum recommended dose, 400 milligrams a day. Metoprolol sessionate, hypertension, heart failure, atenolol, hypertension and angina, and propanol, hypertension, migraines, and anxiety. This is where this comes. This is why people use it. This is an off-label use. I don't think it's actually FDA approved for to treat anxiety, but doctors have became to prescribe them for students, for anyone that that gets very anxious because it makes them very relaxed, and we now know how it makes people relax. It just basically lowers their blood pressure and heart rate. That's what makes them relaxed. Typical starting dose is 40 milligrams twice daily, and the maximum dosage is 240 to 320. Carvedilol, heart failure, hypertension, 3.12 to 6.25 max. The maximum dosage for carvedilol is 50 milligrams a day for heart failure. And yes, dosages are examples and must be determined by a healthcare provider. You shouldn't just go treat someone just based off of these. Every single patient for these uses is different from the other. But these are examples and like the typical ones. Side effects and adverse effects, because they affect systems throughout the body, beta blockers can have a wide range of side effects. Let's sort them. So fatigue, for starters, is a very common side effect. Bradycardia is a very common side effect. Heart block is a very serious one. Bronchospasm, serious. These are a bit rarer than bradycardia and fatigue. Colds and hands, feet, very common. Masked hypoglycemia is very serious. Dizziness is very common. Depression is serious. When I click serious, it means it's a bit rare, but it could happen. But when it happens, it's very serious. Important considerations in consulting. The tapering simulator. So the most important thing for a patient when they want to stop taking a beta blocker is abrupt discontinuation. Never stop taking a beta blocker suddenly, as the stimulation shows abrupt withdrawal can cause a dangerous rebound effect, hypertension, tachycardia, chest pain, or even a heart attack. The dose must be tapered down slowly over 1 to 2 weeks under a doctor's supervision. So let's say this patient is taking 100 milligrams a day of a certain beta blocker. His heart rate is 70, his blood pressure 120 over 80, which is pretty normal. He is going to stop abruptly taking a beta blocker. Let's see what happens. Stopping abruptly, heart rate 145, blood pressure 190 over 110, rebound effect. This is very serious. We're tapering slowly, see, from 100 to from 100 milligrams a day to 0 milligrams every day. We're just lowering by 10 milligrams, and the patient is stable. Please remember this when dealing with beta blockers. The use in diabetes. Beta blockers can mask the warning signs of a low blood sugar. This stimulation shows how. Hypoglycemia stimulation. So let's see this. This patient who has a blood glucose currently of a 90 milligrams of aldehyde letter, heart rate is 75, symptoms normal. Stimulate hypoglycemia. Heart rate 110 and symptoms tremors and the blood glucose has dropped to 50 milligrams. No beta blocker. With a beta blocker, the blood glucose is gonna drop 50. Heart rate is also gonna be a bit drop as well because the patient's currently taking a beta blocker, but the symptoms are gonna be masked. No tremors or other symptoms of a low blood sugar. Used in respiratory disease, non-selective beta blockers like propanol are generally contraindicated in patients with asthma. Cardioselective agents like metoprolol can be used with caution. Please remember this. Taking the medication, some beta blockers like metoprolol, carvedilol should be taken with food to increase their absorption and reduce dizziness. Always follow the specific instruction for your medication. An ICA, which is an in-strict symptomatic activity, some beta blockers like benadryl, acetylbenadryl have an ICA. Benadryl and acetylbenadryl have an ICA, meaning they weakly stimulate beta blockers receptors while blocking strong hormones like adrenaline. This results in less resting bradycardia, and that's why they are rarely used and are not recommended after a heart attack. Key takeaway summary. Primary goal to reduce the heart rate's workload by slowing the heart rate and lowering the force of contractions. Two main types, cardioselective beta 1 safer for lung patients, non-selective beta 1 plus beta 2 affects hearts and lung. A golden rule, never stop abruptly, always taper the dose gradually to avoid serious cardiac events. Key side effects, fatigue, dizziness, bradycardia, and cold extremities are common. Watch for more serious effects like heart block and the ones that we talked about. Diabetes caution can mask the symptoms of hypoglycemia. Monitor blood sugar carefully while taking a beta blocker. The lol suffix, a helpful trick. Most generic names for a beta blocker end in a lol, like metoprolol, atenolol. Test your knowledge. What is the primary mechanism of action for beta blockers? Blocking the effects of adrenaline. A patient with a history of asthma needs a beta blocker. Which type would be a safe choice? A selective beta 1. What is the most critical consulting point for a patient stopping beta blocker therapy? Taper the dose down slowly over 1 to 2 weeks. Which side effect of beta blocker is particularly dangerous for patients with diabetes? Masking the symptoms of hypoglycemia. Propanol is an example of which beta blocker? It is an cardioselective. Cardioselective, yes. Blocking beta 1 receptors in the heart leads to which of the following effects? Blocking beta 1 receptors in the heart leads to decreased heart rate and decreased contractility. Which of these beta blockers also has alpha blocking properties, making it a vasodilating agent? Alpha block, making it carvedilol. A patient reports feeling very tired and dizzy since starting a beta blocker. This is the most likely to the medication lowering their heart rate and blood pressure. Why should medications like metoprolol and carvedilol be taken with food to increase their absorption? What is a common memory aid for identifying the generic names of most beta blockers? It ends with the lol suffix. I got one wrong. Let's see which one. Propanol is an example of which beta blocker? I got one wrong. It is the correct answer is non-selective, not cardioselective. Propanol blocks both beta 1 and beta 2, making it a non-selective beta blocker. This means it affects the heart, lungs, and other areas. It's good that I got one wrong. When I get something wrong, I remember it. That's why we're doing this to study them together. And after you take this, see what it tells you. Correct. The primary cardiac effects of beta 1 blockade are negative chronotrophy, slower rate, and negative inotrophy, less painful, less forceful contraction. I hope you guys enjoyed this. Leave a like and subscribe if you learned something, and this will be in the description. Thank you.